Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Pleural disorders. Introduction. The pleura is a large and thin sheet of tissue that wraps around the outside of your lungs. It lines the inside of your chest cavity. There are many disorders that can affect the pleura. These are called pleural disorders. Pleural disorders can make it hard to breathe. Without treatment, pleural disorders can be life-threatening. This program explains pleural disorders. It talks about general symptoms of pleural disorders. It also explains treatment options for specific conditions. The pleura and lungs. The pleura is a membrane that wraps around the lungs. It is made up of 2 layers of tissue. One layer of the pleura wraps around the outside of your lungs. The other layer of the pleura lines the inside of your chest cavity. A thin gap between the layers of tissue is called the pleural space. The pleural space is normally filled with fluid. This fluid helps the 2 layers of the pleura glide smoothly past each other as you breathe in and out. General symptoms. Many pleural disorders have similar symptoms. The main symptom is sharp or stabbing chest pain. The pain may start suddenly. It may get worse when you breathe in deeply, cough, or sneeze. Pain from pleural disorders may stay in one place in the chest. It could also spread to your shoulders or back. Other common symptoms of pleural disorders include a rapid heart rate, chest tightness, shortness of breath, tiredness. Some pleural disorders may also cause a bluish skin color, anxiety and restlessness, fever and chills, rapid and shallow breathing, unexplained weight loss. Talk to your healthcare provider if you notice any of these symptoms or other changes. Finding a problem early makes treatment easier in most cases. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Pleurisy and pleural effusion. Pleurisy is when the pleura is inflamed and irritated. Pleurisy prevents the pleura from gliding smoothly past each other. Instead, they rub together every time you breathe in. The rubbing can cause sharp pain. There are many causes of pleurisy. Viral infections are the most common cause. Bacterial infections like pneumonia and tuberculosis may also cause pleurisy, as well as infections from fungi or parasites. Other possible causes of pleurisy include autoimmune disorders such as lupus and rheumatoid arthritis, certain types of cancer, chest and heart surgery, lung diseases, pulmonary embolism. Other causes of pleurisy include chest injuries and allergic reactions to certain medicines. Sometimes the cause of pleurisy is unknown. In some cases of pleurisy, extra fluid can build up in the pleural space. This is called a pleural effusion. Extra fluid in the pleural space can push the pleura against your lung. This may cause the lung to collapse. A collapsed lung can cause breathing problems. In some cases, a person may develop pleural effusion even if they do not have pleurisy. Other causes of pleural effusion can include cancer, heart failure, pneumonia, pulmonary embolism, pneumothorax. Pneumothorax is when air or gas builds up in the pleural space. Common causes of pneumothorax include having a lung disease or lung injury. Some lung procedures can also cause a pneumothorax. Examples of these lung procedures include bronchoscopy, lung surgery, mechanical ventilation. Sometimes the cause of a pneumothorax is unknown. Pneumothorax may cause a lung to collapse. The air or gas in the pleural space can put pressure on the lung until it collapses. A small pneumothorax may go away without treatment, but a large pneumothorax often requires treatment. A large pneumothorax can interfere with blood flow through your chest. It can cause your blood pressure to drop. This is life-threatening. Hemothorax. Hemothorax happens when blood builds up in the pleural space. There are many possible causes of a hemothorax. Some of these include certain types of cancer, such as lung cancer, chest or heart surgery, injury to the chest. In some cases, hemothorax may be caused by a sudden pneumothorax, certain lung infections, such as pneumonia, tuberculosis. Like pneumothorax and pleural effusion, hemothorax can put pressure on the lungs. This can cause a lung to collapse. A hemothorax also can lead to shock. Shock is when not enough blood and oxygen reach your body's vital organs. It is a life-threatening condition. Treatment for pleural disorders. Treatment for pleural disorders focuses on relieving symptoms, removing fluid, air, or blood from the pleural space, treating the underlying condition. To relieve symptoms of pleural disorders, your healthcare provider may recommend cough syrups to control coughing, getting plenty of rest, over-the-counter pain medicines. You may also be more comfortable lying on the side that is causing pain. Breathe deeply and cough to clear mucus when your pain is under control. This can help prevent pneumonia. If there is a large amount of fluid, air, or blood in your pleural space, you may need to have it drained. Relieving the pressure caused by the fluid, air, or blood can help prevent a lung collapse. To remove fluid, air, or blood, a thin needle or plastic tube may be inserted into the pleural space. If a plastic tube is placed, it will be connected to a box that suctions out the fluid. It is likely that you will stay in a healthcare facility while the tube is in place. Medicines may need to be placed into the pleural space to break up pus or blood clots. Surgery may be needed if fluid, air, or blood will not drain. Other treatments may be needed for any underlying conditions. For example, if an infection is causing fluid to build up, antibiotics or other medicines may be prescribed to treat the infection. Talk to your healthcare provider to learn more about other treatments.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. The pleura is a sheet of tissue that wraps around the outside of your lungs. It lines the inside of your chest cavity. There are many disorders that can affect the pleura. These are called pleural disorders. Disorders of the pleura include pleurisy, or inflammation of the pleura that causes sharp pain with breathing, pleural effusion, or excess fluid in the pleural space. Other pleural disorders include pneumothorax, or the buildup of air or gas in the pleural space, hemothorax, or the buildup of blood in the pleural space. Many pleural disorders have similar symptoms. The main symptom is sharp or stabbing chest pain that may move to the back or shoulders. Other common symptoms of pleural disorders include a rapid heart rate, chest tightness, shortness of breath, tiredness. Pleural disorders can be life-threatening without treatment. Treatment for pleural disorders focuses on relieving symptoms, removing fluid, air, or blood from the pleural space, treating the underlying condition. To relieve symptoms of pleural disorders, your healthcare provider may recommend cough syrups to control coughing, getting plenty of rest, over-the-counter pain medicines. Talk to your healthcare provider if you notice any symptoms of pleural disorders or other changes. Finding a problem early makes treatment easier in most cases. Thank you for using Explain.